Okay, so we are going to go ahead and get started. A couple things, just to apologize, my house is kind of loud. So I've got my kids here, so I'll try to be on mute most of it. But so we're gonna go ahead and get started. We are so lucky. Whoop, I'm gonna push record. Okay, there we go. So we are so lucky to have Dr. Amy Kotraba. I did it! Yay! Present today. And so she's going to go ahead and tell us a little bit about herself in just a minute. But I did want to say a little plug for parents as teachers. As always, love parents as teachers. So if anybody is not signed up for Parents as Teachers, it is a free program. It is absolutely wonderful. They visit my house once a month to help me with my kiddos. It's always great to just have an outside perspective, different ideas like, hey, what about this? Why don't you try this? And sometimes it's just great to have that extra pat on the back. Like, okay, I'm not the only one going through this, or things like that. So, so anyway, you can go on to the district website and it's a really quick Google form, sign up, and then someone will contact you. So then we've got a couple people coming in. So anyway, the other thing I wanted to explain was the chat feature. So I know we've kind of bounced back and forth between Zoom and Meet on some of our calls. So if you have any questions, you can type it in the chat feature. And then I'll kind of monitor that. And then, but also, if you're super brave, you can unmute, and she would love to answer any of your questions because you might have child-specific questions. So either way is perfect. So last plug is please, please, please. We have tons of topics that we've been able to do this year since we've gone virtual. And so on Barfield's website and also on the Parents as Teachers website, there are links to all of our different presentations, and we've done them for you guys. So please utilize them, share them with people. Anybody that you think would benefit, or it might help if you have a grandparent watch it and they might understand your kiddo or what your family is going through. So anyway, and then give us feedback. Let us know if you have other topics, because we're going to start all over next year with all new topics. So we would love ideas. Okay, so let's go ahead and get started.
All right. Thank you so much, Tara, for having me. My name is Dr. Amy Kotraba. I am a child psychologist. I was sharing with Tara, I actually live in Michigan now. I live about 20 miles north of Ann Arbor, Michigan, but I'm originally from Missouri. So I have a special place in my heart for Missouri. And my mom was a Parents as Teachers teacher for like 20 years. So I have a special place in my heart for that too. So I second your plug. What I'd like to do today is just talk to you a little bit about selective mutism. I feel like an hour really only scratches the surface. There's just so much to learn and understand about it. I started seeing kids with selective mutism when I was coming out of my postdoc experience. So I was kind of brand new to the field of psychology. In graduate school, they had never taught us about selective mutism. And when I was working for a hospital as my very first job as a PhD psychologist, a kid came into our clinic and he had selective mutism, and he had never talked at school, never talked in the community. And about a year prior, he had stopped talking to his parents. Now, that's a pretty, I guess I would call, severe form of selective mutism, not necessarily typical that kids would stop talking even to their parents. But I just got really interested in working with selective mutism. And so I did a lot of research. I went and studied with some of the big names in selective mutism, and I started seeing my own patients, and I just really loved working with the families. And so now I'm 15 or so years out from that. And I've written 2 books on selective mutism. Both are available on Amazon. I do a lot of webinars and workshops on SM. I run a camp during the summer for kids with selective mutism. I just really, really enjoy specializing in it. So hopefully I can pass on to you some information, not just about selective mutism, but I think that this applies really well to any kind of social anxiety or even just general child anxiety. There's a lot of similarities. So hopefully, even if you don't have a child with selective mutism, you'll get nuggets of information out of this presentation that would be helpful. Selective mutism is really a specific anxiety disorder. So it falls underneath the other anxiety disorders. They're with social anxiety, specific phobias like phobias to blood or animals or heights. It's a specific fear of speaking in social situations, and school tends to be the hardest place for kids to talk. But I will say that most of the kids that I work with have difficulty talking in school and also have difficulty talking in the community and to extended family and family friends. It tends to be fairly pervasive, but school tends to be the hardest place, probably because there's so much of a performance piece to speaking in school. You're being graded, people are judging you, there's like social judgment happening. And so in school, a lot of times kids with selective mutism won't speak or won't speak much. And then in the community, so things like, ordering at a restaurant, answering the pediatrician at doctor's visits, being able to read the little screen when you're doing visual tests would be really hard for a kid with selective mutism. It's not due to a primary language disorder, but it's really co-occurrent with language disorders. So depending on what research study you look at, somewhere around 60% of kids who have selective mutism also have a speech and language issue. Other things have been ruled out as the primary cause of not speaking, but it's not uncommon that we see kids have selective mutism and some symptoms of autism. Those things seem to have a slightly higher co-occurrence rate than just the general population. It's rare. It's about 1% of kids in elementary school settings. But what I think people don't think about when they realize that prevalence rate is that means that there's kids in every school that have selective mutism. And oftentimes it goes undiagnosed because these kids are not the squeaky wheels. They tend to be well behaved and kind and smart, and they're not a problem in terms of behavior usually. And so a lot of people will sort of attribute it to, well, they're just shy. Or sometimes it will get attributed to, well, that's just defiant. They just don't want to talk. They don't want to participate in class, so they're choosing not to talk. And it gets missed as a specific anxiety disorder. And so similar to that, or sort of related to that, we do have a lot of evidence that shows that this behavior of not speaking, it's deliberate self-protection. It's not deliberate oppositionality, but it can look kind of oppositional. And to some degree, that makes sense. I think of it sort of like I have a fear of roller coasters. And I'm a very polite and socially appropriate person, I think, I like to believe. And so when I would be asked to go on a roller coaster, my first response would be sort of like a polite no, because I really want to avoid what I'm afraid of. A polite no, an excuse for why I can't go. But if you were to really push me to do something that was scary and challenging, I would probably get increasingly defiant and oppositional. And if you forced me, if you put me in a situation where I had to ride a roller coaster, I would look very oppositional. I would be like kicking and screaming and cursing at you probably by that time. And so what we think is that for kids with selective mutism, what they're trying to do is they're trying to avoid what they're afraid of, which is speaking to people. And sometimes in order to do that, they might look oppositional, and that's just a fear reaction. It's just their intense desire to avoid what they're afraid of. There's a lot of things that go along with selective mutism. Obviously, there's the mutism, but even that occurs on a continuum. And so you've got kids who are, maybe on the more severe end of the continuum, who, basically don't speak in the community, don't speak in the school, pretty much only speak in the home setting or to parents when they're all alone. But then you've got kids on the other end of the spectrum, and those kids might might answer you, but not initiate. Their answers might be really short and concise and quiet. They might even whisper, but they're not going to come up to you and ask you how your weekend was, or, you know, raise their hand to answer a question in class. And so that sort of leads to this question of like, well, is it selective mutism? Is it social anxiety? Is it shyness? There's sort of a very thin line between some of those things. A lot of kids with selective mutism will have blank facial expressions, freezing, poor eye contact. They'll sometimes even have difficulty responding or initiating non-verbally. So even like, I know some of my kids who play sports, at least pre-COVID, you know, would do like the high five at the end of the game. And the kids with selective mutism would have a really hard time doing a high five. They might even have a hard time doing things like nodding or shaking their head, pointing to make choices, shrugging their shoulders. Because even though that's not speaking, it is still communication. And so for some kids, the anxiety generalizes past even talking and into the realm of just kind of any kind of communication. So you might even find kids who have difficulty with writing, particularly writing about personal experiences or sort of like open-ended creative writing, because again, that's very communicative. These kids tend to be slow to respond. They have heightened sensitivities and excessive worries. So we kind of think this is a very sort of simplistic view of anxiety, but genetically, we kind of think that if your genetic light switch is flipped on to anxiety, so if it runs in your family and you have biological indicators that suggest that you have anxiety, then your light switch is sort of flipped on to all of the anxiety disorders. And it's just a matter of sort of how do you as a person manifest that anxiety. And so it's not uncommon these kids who genetically definitely have their light switch flipped on to anxiety will also have other kinds of anxiety, other kinds of worries or sensitivities. They tend to be really oppositional and bossy and inflexible at home. We don't know why that is with certainty. My hypothesis is that it's exhausting to not speak all day. It's exhausting to feel a heightened alertness because they're so anxious about being put into situations where they might need to speak or engage. That by the time that they get home, where they feel comfortable with their parents and their siblings, it just sort of, it comes out as just sort of defiant and oppositional and bossy. And there is a higher rate of bilingualism in the selective mutism population. About 33% of kids with selective mutism are also bilingual. And the hypothesis on that one is that these kids have a genetic predisposition to anxiety. They're put into a situation where speech, particularly expressive speech, is anxiety provoking anyway, right? If you're learning a new language, first you usually learn to read it and then you start to learn to speak it, but speaking it is very kind of embarrassing and you sort of stutter over your words. And so for these kids with a predisposition already to anxiety, even though they're learning the new language, they're not utilizing the new language expressively. What's interesting is that a lot of times after a kid has learned a new language, but has also become selectively mute, even if you spoke to them in their primary language they're very comfortable with, they oftentimes won't speak back to you. And we think that is because it sort of becomes a part of their behavioral repertoire that I don't talk, I don't answer, especially not in public. There's a lot of misconceptions about where selective mutism comes from. Unfortunately, historically, psychology has been terrible about blaming parents, particularly mothers, for all of their kids' problems. Now, of course, that's not to say that environment doesn't play in. We know environment plays into every kind of mental health issue. But what we don't find is we don't find any kind of causal relationship between selective mutism and abuse or neglect or trauma. I think that that's sort of like the storyline that gets played out on Lifetime movies, you know, where like the kid sees his parents die in a fiery car crash, so he stops talking until the kind old man in the town befriends him, and then suddenly he starts talking again. That's not selective mutism. It's sort of a misconception of how it happens. What we do see instead is we see two things. First, we see a genetic predisposition. So we know that for the vast majority, if not all, of kids with selective mutism, there's a family history of some kind of anxiety. And remember, it doesn't have to be selective mutism that runs in the family. If your genetic light switch is flipped on to anxiety, it's all just a matter of how you manifest it. And so it could be that, Aunt Nancy has panic disorder, and grandpa had social anxiety, and dad has some obsessive compulsive characteristics, and kid has selective mutism. There's a genetic line of anxiety that's running in the family. And then the second thing that we know is that kids with selective mutism have biological indicators that are similar to all kids with anxiety. So this piece is very similar to any kid with any kind of anxiety disorder. What all kids with anxiety disorder share is that they have a decreased threshold of excitability in their amygdala. And basically what that means is the amygdala is the part of our brain that's the guard dog. That's the easiest way to think about it. And so our guard dog of our brain alerts us if we're in danger. Now, we're rarely truly in mortal danger, but our amygdala does not know the difference between mortal danger, right? Like we're about to get into a car crash, versus social embarrassment danger, right? I'm about to give a presentation and I might fumble over my words. Our amygdala doesn't have a different way of reacting to those two situations. It's just like an on-off switch. It's like, and it just reacts. It doesn't matter, am I really in danger, or is this just anxiety provoking and I'm uncomfortable about it? The amygdala just simply reacts. And so when these kids are put into situations that are quote unquote dangerous, now they're not truly dangerous, but they feel dangerous, their amygdala is interpreting these situations as dangerous, their amygdala reacts and they get the fight, flight, or freeze response that you probably all learned about in college psychology 101. So their body reacts as if they're in danger. And again, their amygdala can't tell the difference between real danger and, oh, this feels really uncomfortable, I'm anxious. And then their amygdala stays activated for a long period of time. So it takes a long time for them to sort of calm down. Now, something interesting that happens during that is that parents, and I am just as guilty as everybody else, try to reason with them. Teachers do it, administrators do it. We try to reason with kids when they're in the midst of this sort of anxious reaction. Their amygdala has been activated and they're in fight, flight, or freeze response. Now, the problem is that the amygdala, which is back here in the back, and it's the guard dog, doesn't talk to your frontal lobe, which is the part of your brain that's like it's your smart brain. It thinks about cause and effect, and it weighs the risks of situations, and it thinks through, the possible outcomes that you might experience. So when we as parents are trying to reason with our kids in the midst of their amygdala reacting, we're conversing with their frontal lobe. Problem is that their frontal lobe doesn't talk to their amygdala. And so we get annoyed, like, I don't know why they're not just calming down. I'm giving good stuff here. This is good advice. I'm telling them they don't need to be worried. Well, the problem is that their amygdala is already activated at that point. And so those two parts of their brain are not talking to each other. Their frontal lobe really can't calm their amygdala down in that moment. Feel free to stop me and ask questions if you have any. We know that it's about 1% of kids, like I said before. It's about twice as common in females as opposed to males. So about 1.5 to 2.5 females for every male. questionable why that is. One possibility is that at any age, women are just more likely to be diagnosed with anxiety disorders than males. So it may be a true gender difference. It may also be that, especially in childhood, girls are just expected to speak more than boys do. And you can think of even just like the way that kids play together, that, girls, the way that the little girls play together is they interact verbally, right? They play house, they play school, they like animate their little characters that they have, their dolls. And there's a lot of conversation that goes into the playing. Whereas little boys, the way that they tend to play together is like sports, or, chasing each other, or watching TV together, watching sports together, playing video games together. It's not that there's not any expectation of speech, but I would argue that the expectation of speech is reduced for boys in childhood. And so maybe it's just that when a girl doesn't talk, it's more obvious than when a boy doesn't talk out in the community and in school. It's a possibility. Some coexisting problems that go along with selective mutism. The biggest one is social phobia. And sometimes it's hard to even know the difference between those things, but here's the difference. Selective mutism is a specific fear or a specific phobia of speaking and or communicating. Social phobia is a fear of judgment or a fear of how other people are perceiving you. So for about 90% of kids with selective mutism, they will also have social phobia, meaning that they have a fear of speaking, but they're also thinking about how they're being judged. They don't want to be the center of attention. They don't want anybody to be looking at them and watching them. But they are two different things. And so there is a subset of kids with selective mutism who don't have social phobia. They don't mind being like the kid at the front of the dance line, just like dancing their little hearts out, as long as they don't have to talk as a part of that. Kids with SM are more likely to have generalized anxiety disorder, other kinds of phobias, obsessive compulsive characteristics are not uncommon, speech issues. Enuresis, which is daytime wetting, probably because in order to indicate that you have to go to the bathroom, usually that involves either speech to ask to go to the bathroom or bringing attention to yourself. Like sometimes I'll have teachers say, oh, I don't make Jimmy tell me he has to go to the bathroom. He just like flips his card on his desk and then he gets up and goes to the bathroom. But that brings attention to him. It's not like kids don't see him getting up and leaving the classroom. So sometimes kids will have urinary accidents, particularly in school or in the community, probably around not being able to communicate that they need to go to the bathroom. And then things like sensory dysfunction, separation anxiety, and a specific kind of hearing issue in this population. And I'm not an audiologist, so this is my layperson's perspective on this. Basically what it is when I speak, I experience or I hear myself talk. It doesn't hurt my ears. It doesn't bother me. I don't love to hear myself like taped and you hear the playback and you're like, is that me? That's awful. Who is that screechy person on that video? But it doesn't bother me to hear my own voice. And if you talk at the same time that I do, I can still understand for the most part what you're saying. I might miss a little bit of it if I'm talking and you're talking at the same time, but most of the time I can pick up what you're saying. What we're seeing with kids with selective mutism is two things. One is their internal experience of speaking is almost like painful and sounds weird to them. They'll say things like, my voice sounds weird. It hurts my head when I talk. And it has something to do with some sort of hearing issue that influences the way that they're hearing the feedback of their own voice. And the other piece to it is the audiological processing. They have a hard time processing what other people are saying while they're speaking. And so maybe one explanation is, if a kid has these kinds of specific hearing problems, maybe an explanation is that especially in school or in the community, they don't want to miss what other people are saying because it could be very embarrassing. They could not do well in school. And so they just stop talking in order to avoid that. So here's the way that we conceptualize selective mutism. And oftentimes, if you speak about any kind of specific fear, we see that a very similar conceptualization for kids. So what we have is kids coming in who have a genetic predisposition to anxiety, and their amygdala is overreactive, and they get into situations that they perceive as being dangerous. So the very top one, child is prompted to speak or engage, that is very anxiety provoking for these kids. When they get into these situations that, I mean, probably happen 100 times a day, probably 100 times a day, if not more, you were prompted to speak with somebody. You said hi to somebody as you passed by, you answered somebody's questions, your kids were asking you questions, you were answering them, you had to talk to somebody at the gas station. I mean, these opportunities come up numerous times per day. So for these kids, this is happening numerous times per day. When that occurs, they get too anxious, and they do what all of us do when we get too anxious, and that is that they avoid. They avoid this situation that's really anxiety provoking. And that's just human nature. I can guarantee that if you are uncomfortable and anxious about something, your first thought is, how do I get myself out of this? Right? Like, how do I not do that? Can someone do that for me? I feel sick. Maybe I'm sick today. The interesting part about childhood anxiety disorders is that for adults, when we get into situations that make us anxious, we only really have two options. Option number one is avoiding. Now, that usually gets us into some trouble over time. Like, if your job involves making phone calls and you aren't making the phone calls because you're anxious about it, you're going to lose your job. But adults could avoid, or they could cope individually with the anxiety. They could do things like distract themselves or change their thought patterns or do deep breathing or exercise. These are all things that help them manage anxiety. But kids have a third option. And a kid's third option is to lean on the caregiver or lean on others in their environment to help keep them safe. It's an evolutionary sort of option that they have, and most of them will take it. And so the kid gets too anxious and they avoid. And I have in here adult rescues, but to be honest with you, like peers rescue, siblings rescue, there's all kinds of rescuers out there because we don't like to see kids struggling, right? We don't like to see kids uncomfortable. And so oftentimes someone will step in and answer for the child, or stop asking them questions, or only ask them questions that they could nod or shake their head or point to. Or a peer will say like, oh, Natalie doesn't talk, to sort of circumvent her having to interact with somebody. When we rescue the child, it decreases the child's anxiety because they don't have to face that thing that they were afraid of. But it also decreases the anxiety and discomfort of everybody around them. And so unfortunately, what happens is we're all really reinforced for our behavior. Like, the kid is reinforced for avoiding, we're reinforced for stepping in and saving them or rescuing them, and then we're all more likely to play this out again. And so this becomes problematic when it's played out 100 times a day, 7 days a week, over and over months, over years. We get really good at rescuing, and the kids get really good at avoiding. And so this becomes this problematic cycle. And it happens, it's a slippery slope. It happens very easily, and we don't even notice that we're doing it. And so some of the places that we try to intervene, and I say we because I don't just mean psychologists. Selective mutism is really like a group treatment. Like, we all have to be really working together, the school, the parents, the pediatrician, grandparents. It's helpful to have all of us working together. So some of the things that we do differently, one is that we try to change the way that we prompt kids to speak or engage. And I'll talk about that in just a minute. We try to reinforce them for being brave and doing things that are hard and uncomfortable instead of accidentally reinforcing for avoidance. We try not to step in and immediately rescue. Now, I don't mean that we're like, well, son, pull yourself up by the bootstraps because tough, I'm not ever going to help you out with this. But we try to be a lot more careful about very quickly stepping in, very quickly speaking for the child. So I'm going to talk you through a few of those things, a few of these sort of tips for how to help kids with selective mutism. I will tell you, it's so hard for me to condense this because usually when I do talks for selective mutism, they're like a full day, like 6 hours of teaching. So I'm going to kind of touch on these things. If you're interested in any of this and want to learn more, I have 2 books. There's a lot of really good books on selective mutism. I would encourage you to go find out more about these intervention techniques.
Amy, I have a question and I hope I didn't miss it. I'm just curious, like when I listen to all of this, how often are these kiddos like not a firstborn child, but a secondborn or a thirdborn? Like just curious, like what that looks like, because I wonder when I think of like a busy family, how easily that could be missed. And just thinking, oh, that's such a second kid thing. Like your brother always talks for them anyway. So I was just curious your thoughts on that.
Yeah. I don't know how much research has been done about birth order and selective mutism. So I can only share what I have tended to see. So take this with a grain of salt. I do tend to see that it tends not to be the firstborn. In fact, firstborns tend to be the rescuers of these kids a lot of times. Like they'll talk for them and they'll like make sure their needs get met. And they're sort of like, firstborns, we're large and in charge in the family. And so it's common that these tend to be the second or third child in families. And yeah, it's sort of like, well, these kids they're not a problem, they're not a behavioral issue. So kind of like life just goes on and maybe parents aren't as concerned about it until, kindergarten and first grade and the school is saying we can't assess your child because they're not speaking, they're not participating verbally in school. And then it does become an issue. The other thing that we tend to see is because selective mutism is a genetic disorder, something that runs in families, it's not uncommon that we see this in multiple siblings or twins particularly. We'll see both of them have selective mutism. So that's not uncommon to see also. So when we're thinking about the goal of treatment, and again, I don't want to see treatment as if like this is something that I do as a psychologist in my office, not you as parents. When I think of treatment, I think of all of us working together for this common goal. So our common goal is not to make anxiety go away. And again, the stuff that's on this page is true of all kinds of anxiety disorders. And it's a hard pill to swallow, but I can't make your child's anxiety go away. And to be very honest with you, I don't want to, because anxiety is helpful. It warns you, right? You need to have anxiety. My goal is to help your child be comfortable with discomfort. Even as an adult, even doing what I do, I still feel anxious. The benefit that I have when it comes to anxiety is I have learned over time that being uncomfortable doesn't mean that I'm in danger. And it doesn't mean that I can't go ahead and do the things that are important, right? I can feel anxious and still go to that new yoga class. I can feel anxious and still do the presentation. I can feel anxious and still introduce myself to somebody, because anxiety is going to continually come up in your child's life. So learning how to manage it and live with it and just being comfortable with like knowing that this is going to happen, that's my big goal, because I think that's a lifelong skill. I already talked to you about how we can't talk your amygdala out of a fear because your frontal cortex doesn't speak with your amygdala. What we have found, though, is that in order for your amygdala to learn, because it can, your guard dog can learn, the way that it learns, though, is through experience. And so you have to feel uncomfortable and then still go ahead and do it in order for your amygdala to learn. That is the way that it learns that that thing that it was afraid of was not actually dangerous. And this makes sense, right? It's like If you had a fear of heights, the thing that you've got to do, you can't talk yourself out of it, right? You've tried. You can't like read books to try to get better. What do you have to do? You have to go to the second floor. You have to look out the window. You got to stay there until you're all right. You're uncomfortable, but you're okay. And then you go up to the third floor, and then you go up to the fourth floor, and eventually you go all the way to the top of the building. And then you get on a plane. And you have to have these experiences, because what they do is they teach your amygdala that what it was thinking was dangerous is not actually dangerous. And so that's basically what we're asking kids to do, is face their fear in small, manageable doses. And we're, of course, going to give them a lot of support and hopefully some reinforcement and rewards along the way. But that it really requires them doing the things that they're afraid of in order for the anxiety to dissipate and just generally to sort of learn how to feel comfortable with discomfort. Medication is sometimes used with selective mutism. The most common ones are SSRIs, which like Prozac, Zoloft are common ones for kids with selective mutism. It's not effective alone. Some parents think it's like a magic speaking pill. That's just not how medication tends to work for kids, but it can be really useful, as I call them, like water wings. Like, I don't even know if they have these anymore, but you know, like the blow up orange things that your kids wear when they're learning to swim, and you put them on so the kids don't drown while they're learning a new skill. I think of it in this similar way of like, sometimes medication is really helpful just to keep them afloat while we're doing really hard things and learning some new skills. And eventually our goal is going to be that we don't need that anymore, because they will have learned the skills, they will have practiced the skills over and over again and had new experiences, and that will become unnecessary. But it can be really helpful for kids with selective mutism. Then I really believe in talking to kids about anxiety. I think it's very empowering. Kids don't really, I mean, adults don't really understand anxiety a lot of the time. And so I talk to them a lot about their amygdala and how it works. It's their guard dog. And I mean, what they have is just like a really amazing, really sensitive guard dog, which is great. Their brain is really trying hard to protect them. But the problem is that it's getting in the way of them doing fun stuff and them doing the things that they need to do, like talk in school. And so my job is to be their brave coach. And as their brave coach, I'm going to help them to build brave muscles. And we have brave muscles just like we have muscles in our arms and muscles in our legs. And they get bigger and stronger with practice. It's uncomfortable, right? It's a little uncomfortable when we use our muscles differently than they're used to. But if they hang with it, it gets easier, they get stronger, and eventually those things that were hard in the past won't be hard anymore. It won't be challenging anymore because their brave muscles will be big enough that it's not a big deal anymore. Sometimes I'll give them the example of any kind of new skill. Like, I bet when you learned how to ride a bike, it was really hard. And you were like, I stink at this, and I'm really uncomfortable, and I'm probably gonna have an accident. And you would only go on like the really paved, flat areas. But over time, if you practiced and you practiced, you just got better and better until you don't even think about that anymore. And you can go on unpaved roads and, you know, dirt paths and up hills and down hills, because you know how to do it because you had a ton of practice. We're going to do the same thing. Our job is to practice being uncomfortable, practice doing things that are a little bit hard. Every time you practice, it's going to get easier. I'll also give them, I like to talk to kids about how their body is actually made to get used to being uncomfortable. And so for a lot of kids, I can give them the example of, you know, when you jump in a really cold pool and your first thought is like, I gotta get out of here. Like, this is super cold. I do not want to stay in here. If you don't get out, what eventually happens? Well, eventually the pool doesn't seem so cold anymore, right? And you can stay in there and it actually feels kind of fun. That's not because the water suddenly gets warmer over time. What happens is that your body is made to get used to feelings of discomfort and adjust itself. And so what's really cool about your body is that when we start doing this stuff, it's going to be uncomfortable, but your body will actually learn to adjust to the discomfort and it'll get easier. And so the example that I'll give kids is we'll get those like really spicy warhead candies. And me and the kid will both take one and I'll have them put it in their mouth. And I'll talk about how, like, at first when you put it in, it's like, oh, it's really bad. And you just want to spit it out. It tastes terrible and it's really uncomfortable. But if you keep it in your mouth over time, it stops tasting bad and it's not uncomfortable anymore. That's not because the warhead changed its flavor. What happened was your body habituated, is the grown-up word. Your body got used to the discomfort and it actually adjusted itself so that now it doesn't feel as uncomfortable anymore. So I think that this is all really, now, of course, younger kids, this explanation is much shorter. For older kids or teenagers, I'm spending a lot more time talking to them about this because I want them to take ownership and understand why we're doing what we're doing. I think it's really important and really empowering because this again is true of any kind of anxiety issue, that if they understand it, they know where it's coming from, it doesn't feel as out of their control. Some of the ways that parents can help. I always talk to parents about how you cannot take a typical kid and give them selective mutism by your parenting. Like it doesn't happen. But what we do know is that parents tend to step in and rescue kids, oftentimes way too quick. And that's just because no one likes to see their child struggle. No one wants to see them uncomfortable. And so some of the things that parents can do is really try to be aware of, oh gosh, I tend to, like, a lot of parents that I talk to will say, oh, I tell everybody that they don't talk because I don't want anybody to like start asking them questions. So they started karate last week. I already went and told the karate teacher they don't talk, so just don't ask them questions. And my response is like, well, then I know that they won't talk because no one's going to ask them a question. They were sort of like stopping the gate before it even opens. So trying to reduce accommodation or rescuing, we use those terms interchangeably. And then making what we call supportive statements. So supportive statements have two pieces to them. One is empathy. And empathy doesn't mean, yes, this is really scary. Empathy means this feels really scary, right? Because the kid's experience is that it's really hard and scary, terrifying, and uncomfortable. So you're simply saying, this feels really uncomfortable. This feels really hard. That presentation that's coming up tomorrow makes you feel really uncomfortable. But then you add on this piece of confidence, this confidence that the child is going to be okay, is going to be able to do it, is going to be able to overcome this. So it sounds something like, it's really scary to talk to your teacher, and I know you can do it, right? Or you're kind of feeling overwhelmed about that big test tomorrow, and I know that you'll be fine. Not, I know you're going to get 100%, because to be honest, I don't know, but I know that they're not going to break. I know nobody died from like getting a bad grade on a math test. It just doesn't happen. And so an empathy statement with a confidence statement helps kids understand both that you understand where they're coming from, but also starts to build their confidence. Like if you hear somebody say over and over again, you're competent, you are competent, you can do this, you've got this, you kind of start believing it yourself. So the more that parents can do that, the better. And then the really hard part is allowing their kids to struggle, right? Like allowing kids to be uncomfortable, letting a pause sometimes happen where somebody asks them a question and you don't jump in and answer for them. Like being okay with, my child can handle that and I can handle it, because that's a part of it too. It's really hard. And then we ask kids to sort of slowly face their fears at a reasonable pace. We're their brave coaches. So I'm not going to make a kid do anything I'm not going to take a kid who's, not able to answer the teacher one-on-one and go ask them to do a presentation in their class tomorrow. That's ridiculous. But I might ask them to do something that's just a little bit beyond where their comfort level is, right? And so I'm asking them to sort of set these small goals. We're practicing together, something that's a little bit outside of their comfort zone. So I won't spend much time on it because we don't have much time, but some of the sort of skills that you would use, you give a lot of labeled praise for talking or communicating. So, oh, I love how you told me about your trampoline at home. Right? Talking to them about how awesome it is. Reflecting verbalizations is just saying back what they said. So if they say, I like to go on my trampoline, you would say, oh, you like to go on your trampoline? I love going on my trampoline. That's so fun. It's basically what you're doing is you're saying, I heard what you said. I heard what you said. I liked it. This is great. I heard what you said. It helps lower their anxiety when you do that. Asking forced choice questions instead of yes, no questions, or sometimes you can ask open-ended questions, but forced choice questions significantly increase the likelihood that a child will answer you. So instead of asking like, what'd you do last summer? Because yikes, that's a really hard question for a kid to answer. Or instead of saying like, do you like bike riding? Because they could easily nod their head. They do like bike riding. You could say something like, ooh, what do you like better during the summer, swimming or riding your bike? Now you've given them a limited number of options that they could answer. So they don't have to search their brain and think like, what did I do last summer? Ah! And you also didn't really give them the opportunity to answer non-verbally. So you're creating a situation where they're more likely to verbally answer. And then once you ask the question, be prepared to wait at least 5 seconds before they answer. Now, this is a socially inappropriate amount of time. It is uncomfortable. It doesn't sound like much, but we usually give people 2 seconds to answer our questions. And so 5 seconds or more is like everybody's like cringing a little bit inside. But the reason that we do this is once we ask a child a question, I want to give them time to think about their answer because these kids do tend to be just generally slow to sort of process how they want to answer and respond. But I also want to indicate to them that I really mean it. Like I'm not just flippantly asking you a question, I'm just going to answer it myself and go on. I really mean to wait for your answer. And so we have to sort of be okay with the discomfort that comes along with that. Oh, here's where I talk about the kinds of questions. So forced choice is the best option. We want to stay away from yes, no questions because they sort of incite nonverbal responding instead of verbal responding. You really want to stay away from complex questions like, what's the capital of Virginia? Most kids aren't going to know the answer to that, right? We're not trying to be tricky. Really open-ended questions like, what did you do last summer? Feelings questions like, how do you feel about year-long school? Like a lot of these kids, that's really hard because it's an opinion question. It's very personal. So the more forced choice questions you can give, the better. And then some other tools that psychologists will use, and they're not hard to learn. I would encourage you, if you're interested, you could look them up online. You could read one of my books. Stimulus fading is basically taking existing speech and slowly bringing new people into it. So instead of you and your child are at the grocery store and somebody quick comes up to you and says like, oh, buddy, you're so cute. I love your shirt. How old are you? And suddenly the kid is like, whoa, put on the spot. That's very anxiety provoking for these kids. Stimulus fading is this slow and gradual movement of somebody new into your conversation. So basically the idea is that the parent and the child are talking and someone kind of comes closer and listens and reflects and comments on what they're saying and then eventually asks the child a question. It's like this slow progression where a new person can come in. And I put instructions on how you can even do this online. You know, when everything sort of shut down with COVID, we as psychologists went like, oh crap, now all of our patients are home and we can't help. And we've actually found that selective mutism can be really well treated online. And so this is just sort of a instruction guide too, if you want to try this. we also are trying to constantly increase the difficulty level of the child's speech. So we're constantly pushing them to do more complex speech than they're currently doing. So if a kid is only sort of like making sounds like meh or like we're going to try to move them up this ladder towards increasingly complex speech. We're going to do activities, we're going to give them rewards, we're going to ask forced choice questions, we're going to give them time to answer, so that we're asking them to constantly, go from one word answers to giving me a longer answer, to asking me questions, to raising their hand and initiating in class, to interrupting a conversation, so there's these sort of levels of difficulty. One of the interesting, quirky things about kids with selective mutism is they tend to have a really hard time with greetings, polite words, and names of people. And I mean, I have my hypotheses on why this is, but it's kind of a weird and funky thing. And so a lot of parents will say, okay, all I want you to do is say hi to the teacher as you come into the room. And the parents thinking that this is not a hard thing for a kid to do, right? Everybody else is saying hi. It's totally normal. It's really short greeting for the teacher. But the problem is that it's a greeting. And a lot of kids with selective mutism have a really hard time with greetings and polite words and proper names. And so that might be harder than if the teacher was just to ask the kid, what'd you do last night? Did you watch TV or play with your dog? That might be easier because answering is easier than initiating, especially with polite words or greetings. And this is sort of like a flow chart. I love flow charts. This is like a flow chart of what you would do when you ask a child with selective mutism a question. So you would ask them a forced choice question like, what do you like better, cookies or brownies? And you wait, right? And if they give a verbal response, then you would say, cookies, I love cookies. That's a good answer. If they give no response, then you wait 5 seconds and you repeat the question. So you would say, what do you like better, cookies or brownies? And they don't answer. You would wait that uncomfortable. What do you like better, cookies or brownies? Now, if they don't answer, or if they give a nonverbal response, well, if they give a nonverbal response, you probably asked the question wrong because you really want to stick with those forced choice questions. But like, let's say that you had a big picture of a cookie, right? Or you were like holding a cookie and a brownie in your hand and they could just point to whichever one they wanted. You want to wait 5 seconds and probe for the verbal. So you want to say something like, oh, I see you. I'll put my hands behind my back. I see you pointing, but I'm not sure which one you pointed to. What do you think? Do you want a cookie or a brownie? Because I really want a verbal response. But if you still don't get a verbal response, you wait 5 seconds again, and you're probably going to have to make it easier. You're probably going to have to take a step back. So maybe that means accepting a nonverbal response, like pointing. Maybe it means just getting a sound, like saying, well, if you like brownies better, you could say B. And if you like cookies better, you could say K. Maybe it means pulling the child aside and asking them the question somewhere private, because maybe it's just too hard because there's like other kids around who might judge them. But you want as much as you can to sort of end with a win, to end with them being able to interact with you. I put this in here as
Amy,
well.
I have a question.
Sure, yeah.
Sorry, real quick. So do you ever recommend, especially if you know the kiddo, doing choices that one of the answers they don't want or they don't like? Or do you think that kind of sets up for failure? But like, I specialize in autism, so that's kind of like a way that I can get them to communicate with me, because I know if one of the choices they don't want, so it helps that okay.
Yes, definitely. We would call those motivationally driven interactions, right? Yes, absolutely. Or like, I'll put a silly answer in, right? So if I'm not sure that the kid knows the answer, so for instance, when we're at the point where the kid should be answering the teacher in the classroom, I'll have the teacher give a forced choice question to the kid. I'll have the teacher say, Jason, what were we talking about yesterday? We were talking about the Jurassic period, and we were talking about these big things that roamed the earth. Were we talking about dinosaurs or macaroni and cheese? Right. So I want to set them up in every way possible to respond. So yes, definitely. Here's some ideas for exposures that you can still do even during COVID, even during social distancing. There are ways that kids can continue to practice to be verbal with their teachers, with people in the community, with extended family members. I've been trying to encourage parents that this isn't a time when you just can't do anything about selective mutism. There's all kinds of things that you can do. Arguably, people have more time to help you out and to get online with you and to take phone calls, because our schedules are wonkier than they used to be. And then here's some fun games that you can play with kids that sort of elicit speech. Things like Guess Who and Headbands and Hangman, Would You Rather game, or I Spy. These games necessitate speech as a part of them. And so kids are more likely to talk more when you're playing these kinds of games with them. And then just some tips for encouraging speech, and remain calm yourself. It's really uncomfortable. It's really uncomfortable to see a kid uncomfortable, especially when they're your kid. But just trying to remain calm and know that you're doing the right thing, that being uncomfortable isn't dangerous for them. It's just uncomfortable. Use a lot of specific phrase for any speaking behavior that they do. Some kids don't like this, and I tell parents, do it anyway, just do it matter of fact. Some kids will be like, don't tell me I did well on that. I still want to tell you that you did well, but I'll just be real matter of fact next time. Nice job, that was cool. Right? And then just go on instead of blubbering over how great it was. Always waiting the 5 seconds for a reply, trying to always ask things as forced choice questions because it increases speech. Being careful not to mind read. Kids have all these ways that they can get all their needs met without speaking. So trying to create situations that will elicit speech, and then being careful not to step in and be like, oh, you want to play this game? Really trying to have them answer or speak in order to get those motivationally driven situations. And then some specific school interventions. School is such an important part in treating selective mutism. It's very hard for me to treat selective mutism without the school being involved in it. And so having these brave practices being done in the school with what I call a key worker, but it's like a case manager, a social worker, school psychologist, a school counselor who's doing these practices with them, generalizing it to the teacher, maybe running chores that involve speech, continuing to be involved in extracurriculars, even if it makes the child uncomfortable, because it gives more opportunities for them to talk, seating them next to kids that they're more likely to speak with, allowing kids to go into the school during the summer and just practice talking even when there's nobody there, because we want the school to be a place where I talk, allowing the parents to come and play on the playground with the kid during the summer, meeting the teacher before the new school year starts so the child can get verbal with the teacher. Those are all really important. All right. I know I went kind of to the very end. Does anybody have any questions that we didn't already talk about?
So the information was amazing, absolutely amazing. So there's a chance I'm going to be asking you to maybe present a second time and go more in depth, because everything you kept saying, I'm like, oh, I'd love to know more about that. I'd love to know more about that. So we might be having a separate conversation, but you did fantastic. Thank you so much for all the information for our parents and for me.
Thanks for having me. I'm happy to come back and help.
Great. Well, thank you so much. So if there are not any more questions, sorry, I'm rocking a baby, multitasking. But if you do have questions, you can totally email me. I can have Addie put my email address out there, and then I can possibly get in contact with Amy and pass along some questions. So Thank you so much for speaking tonight.
Thank you. Have a great evening. Thank you
All
all
right.
for
You as well. Thank you. All right. Bye-bye.